Hey, Fat Celiac here today. I wanted to talk a little bit about refractory celiac disease and what that means. So, refractory celiac disease is celiac that does not respond to a gluten-free diet. Theoretically, after a year, maybe even two, all the blood work should have normalized and you should have all the villi in your intestine healed. Refractory celiac is when those villi don't actually heal. Normally the symptoms are ongoing symptoms like diarrhea or upset stomach, extended fatigue. And what they typically do is they check your blood work. Blood work's good. And then they do an endoscopy to determine how the villi have healed. Now, within the biopsy they take, they look at the intraepithelial lymphocytes, which are basically white blood cells in your small intestine. And if a certain percentage of those are aberrant or not normal, they typically will diagnose you with refractory celiac. If you have more than 20% of those little intraepithelial lymphocytes are aberrant, they will diagnose you with refractory celiac disease type 1. Refractory celiac disease type 1, if you have that, they typically will prescribe prednisone to help your body heal. It never goes away. And there are other drugs, but prednisone is the first level. An Entocort, there's an Entocort oral. Entocort is normally an inhaled type steroid. Entocort oral is something that you take and it acts in the intestine. So that's refractory celiac type 1. Refractory celiac type 2 is the bad one. You don't ever want that one. That one is typically associated with people who are diagnosed older in life, and it's where those intraepithelial lymphocytes, greater than 50% of them, are aberrant. And that typically is related to enteropathy associated T-cell lymphoma, which is not the stuff you want, which is really bad. Fewer than 10 cases in the United States are diagnosed of refractory celiac type 2 annually. So it's not something you really need to worry about. But if you have ongoing symptoms and it's been more than a year, you typically will need to talk to your doctor about a refractory celiac type diagnosis. My name is Fat Celiac, and that's our 3-minute video today. Thanks. Bye.